And just a few facts just about SNAP in New York State. In March, 2.9 million SNAP people in New York State receive SNAP benefits. 2.9 million people, and the amount in just 1 month was $664 million. Just 1 month. Over the course of the year, assuming the caseload amounts would stay the same, that's about $7.8 billion. $7.8 billion, again, billion with a B. So 1 million times 1,000 times 7.8. And if these cuts go through in Washington at the level proposed, it could be a $23 billion cut over 10 years, or as the governor said, about $2.2 billion per year. And once Feeding America uses a statistic, which I think is correct, that the SNAP program equals about 10 times the dollar amount of food distributed by every food bank and soup kitchen and food pantry in America, and that's an astounding number. But I've calculated when you add in WIC for pregnant women and children under 5, when you add in school meals, when you add in the FEMA Emergency Food and Shelter Program before it was summarily eliminated by this administration without any explanation. When you add in the senior programs, a lot of people don't know that Meals on Wheels gets a lot of funding from the federal government, don't know that senior center meals get a lot of funding from the federal government. When you add in all the federal support, as well as the federal support for food banks through the TFAP program purchases, the federal safety net equals 17 times the dollar amount of food distributed by every charity. So while the Food Bank for New York City and Rescuing Leftover Cuisine and all these nonprofit partners do amazing work, they can only fill in a small percentage of that work, of that gap. And that's why the safety net is just so important. Until the time we have living wage jobs for every able-bodied person and they don't need it, we desperately need these programs. So, Commissioner, thank you so much for coming. Thank you for your work every day. Thank you for your staff. Tell me why you think the work you guys do is so important.
Obviously, we don't want people to be hungry is number one. We do administer a range of different social benefit programs, including SNAP, home energy assistance support, public assistance, and other programs that we administer. So our number one goal is really to help people become more financially stable so that they can go to work, hopefully obtain appropriate housing, et cetera. But as you've mentioned, the statistics are quite alarming in the United States, including in New York State, with respect to the number of individuals that live in food insecure households, which does add tremendous stress to a family. We know that financial stress overall creates negative outcomes for children, negative outcomes for communities, and certainly food insecurity is a really big part of that as people are trying to make their wages or benefits go as far as they can in terms of just meeting basic everyday needs. So it's absolutely critical, the work that we do, and I also want to thank you, Joel, for inviting us here today, and thanks Susan Zimmett, who has really spearheaded the Restaurant Meals program for our agency.
Now, we're here in New York City, and a lot of people know this is a problem in the city, but you travel around, the state tells, you agree with me, this is a serious problem. Suburbs, in rural areas, that there's no one stereotype, not only person who needs this help, there's no one stereotype community.
Absolutely. It's certainly potentially even more of an issue in rural areas of the state where people not only lack financial resources, but often access to appropriate stores where they can purchase food. So it definitely hits all communities and all kinds of individuals, right? It includes individuals who may be disabled and unable to work. It includes people who are working, including families who are working full time. So SNAP is absolutely critical to help meet the gap for these families.
And also in terms of proximity, I don't know if Food Bank, what your latest count of agencies that are actually hunger agencies as opposed to other places you're providing food. I think it's somewhere around 800. Yeah, right. There are 8,000 retail establishments in New York City that accept SNAP. 8,000, and many are open 24/7. And so nothing the charities could even begin to do. And how important is SNAP in reducing food insecurity, or at least limiting food insecurity in the state?
I mean, it's huge. SNAP is the largest and most effective anti-hunger program in the nation, including in New York. So it's critical. It's extremely, I know we'll talk about the federal stuff in a bit, but it's really concerning that some people seem to underestimate its value. And it is such a large program. Again, it's like one of the most important federal safety net programs that it's something that with deep federal cuts, not only can New York State not make that up, but I mean, no state really is going to be able to easily absorb the cuts or the cost shifts that are included in the House bill.
Yeah, and SNAP provides at least $1.5 of economic benefit for every dollar the federal government spends on it. And statewide, again, there's, I don't know the exact number, but at least probably 15, 20,000 places. Do you know how many retailers are on the state?
I believe they're just over 17,000.
17,000.
And the economic impact is over $11.5 billion.
Just go to true or false. True or false, undocumented immigrants are not eligible for SNAP.
True.
Never have been in American history.
True.
And so there are people saying, oh, this bill is going to ban undocumented immigrants from getting SNAP. They can't get it now. And so their implication that these billions of dollars of cuts are coming out of that just is factually untrue. And I won't bore you guys getting deep in the weeds. We get into so-called error rates versus trafficking rates. But error rates are when, because I don't know how long it is now, but a few years ago I looked at the rule book for administering SNAP in New York. It was a few hundred pages. It probably still is. Extraordinarily complicated rules and made complicated by Congress and USDA, and then they turn around and blame the states if someone makes a microscopic mistake. So the error rates are if the government gives people a little too much or a little too little. And it's not like, the average SNAP benefit in New York is a little over $2 a meal. And so you're talking a little about this, that it's not a reflection of fraud. Fraud in the program is less than 2%.
Fraud in
it's a
the program
reflection
is
of
very low.
Minor
Yep.
Things where someone was supposed to get $2.10 a meal and maybe they're getting $2.20 a meal, or they were supposed to be getting $2.20 and they were getting $2.40 or something.
Yeah, and certainly this is something that members of Congress are using as what I would say an excuse or kind of a cloak to justify the cuts or the cost shifts to the states. But error rates are higher now than they were pre-COVID. That's a fact. New York has been both above and below the national error rate. Before COVID, we were below the national error rate. We are currently above the national error rate. The cost shift start is for any state that has a payment error rate over 6%. That's almost every state. So there are only 7 states that are below 6%. They're all very, very small. And it definitely is not a reflection of fraud. It is a reflection of the complexity of the program, the fact that there were a lot of changes going on during and after COVID. And we know whenever you introduce program rule changes, it sometimes makes it more difficult to get it right. And then probably the most important factor resulting in the increased error rates for New York and other states is just the fact that post-COVID, counties in New York City were really struggling to get workers in the door and keep workers in the door. And so government, just like businesses, they were struggling with workforce issues. And I would say that is probably the driver of the increased error rates. So again, I think it's just being used as an excuse and something that they can say to try to justify what is really absolutely unjustifiable recommendations.
Right, and when you're applying for SNAP, you have to prove every assertion with paperwork. If you're a billionaire filing your taxes, you don't have to provide your receipts unless you're rarely audited. So you have to provide your income, you have to prove shelter, expenses, you have to prove who's living in your home. If there are 3 Joel Bergs in the database, I have to prove I'm not the 2 that owe child support. So can you talk about just how challenging it is for a state to manage this program?
Yeah.
And how many staff do you have to manage a program that gives out billions of dollars a year?
I can't answer that question because the staff really who are doing the majority of the work are at the local level.
At the county
But
level.
overall, the administrative cost associated with staff, I believe it's definitely under 15%. It may be under 10%. It is not excessive. The rules are very complicated. We need to do a better job at the state level by providing better systems for workers to use so that it's easier for them to calculate proper benefits. And also just the need to address paperwork as soon as it does come in. So people sometimes will submit documentations or changes with respect to their income, and workers don't always get to that timely. And so that also is kind of triggers error rates. But overall, it is a very efficient program with respect to delivery of food benefits.
Right, and without relitigating welfare reform, and I worked for President Clinton then, I have a very nuanced, complex view on that, but the bottom line is far fewer people in New York State and anywhere in the country get cash assistance.
Absolutely.
And SNAP is the last really broad-based, I wouldn't say income support. Sometimes the right says it's not really food, it's income support, but it is supplementing household incomes. For all the talk that that Medicaid is welfare, Medicaid money doesn't go into the pocket of low-income people. It goes to doctors, hospitals, home health care, companies, medical supply companies, prescription drugs. The last really big benefit that goes to large numbers of struggling Americans is SNAP, is it not?
It absolutely is. As you mentioned earlier, 2.9 million individuals in the state of New York. So definitely that is exceeded by Medicaid health coverage. But similarly, it doesn't, it definitely is an economic support for families. But again, the dollars go to retailers.
Right. So let's switch to the SNAP Restaurant Meals Program, and I know a lot of you are most focused on that. A number of years ago, Governor Hochul proposed, and the legislature passed a bill to require OTDA to apply to the federal government to be approved to do this. In the last administration, OTDA was approved to do that. It's not necessarily well known that SNAP recipients can legally authorize people to shop on their own behalf. And some people with disabilities do, some elderly people do. Now, some elderly people is just as energetic as me, so I don't want to be ageist, but some need help shopping on their own. And so USDA and Congress understood that and created these provisions called the SNAP Restaurant Meals Program that has 3 categories of people who are eligible. People with disabilities, or households with people with disabilities to be
Individuals and their spouses.
Right.
Right.
Got it. People who are unhoused and people over the age of 60. Talk about why that's important to your agency. And I know Susan's going to go into greater depth of that, but why that program's important.
I mean, it really is just another opportunity for people to have access to food in a different way. And obviously, if someone's homeless, they may reside in a shelter that doesn't have appropriate cooking facilities. So again, just another option for individuals that are, of course, if you're homeless and unhoused, definitely important. And I know some of the stories that Susan has shared with me also have been really eye-opening in terms of some of the social supports. Like people can, especially elderly in some areas, it's a way for people to have resources to go out and socialize with others, or for a family perhaps to celebrate a really important event in the family that they otherwise would be unable to do. So it's just another option.
Now, normally, it's not OTDA's job to oversee the retailers in SNAP. Normally, it's USDA's job.
Yep.
But it's complicated in this realm because for this program, they said it's your job.
Correct.
And it's just so you understand, with USDA's oversight. And,
Yep.
No, it's a little more, we can get into it.
But one of the things to note, and many of you are aware of this, if you're shopping at a grocery store and there's 2 rotisserie chicken there, one hot, one cold, same brand, same size, same price, you're allowed to use your SNAP benefits, and the retailer is allowed to sell the cold chicken, but not the hot chicken. Even though some of those folks may get home energy assistance through your agency, and they may have to spend extra government funds to heat it. So I know we're not here to talk about that, but Congresswoman Meng does have a bill to change that.
Yeah, and having the ability to use SNAP benefits to purchase hot foods and prepared foods would also be a game changer for folks. And often, we also know often that is one of the least expensive, not only convenient, but can often be really cost effective.
And
For some reason, the rotisserie chicken is always the one that people talk about, but
I've raised it for like a decade, so I'll take some.
maybe this year, Joel.
So how difficult is it for you as an agency? And again, I don't want to press you too much, but bottom line is your caseload over the last few decades has skyrocketed and your staffing hasn't. So that's just a fact. You're doing more with less. How difficult is it to communicate with clients and also understand most states, the state government directly runs, SNAP. In New York State, it's delegated by state law to so-called social service districts.
Districts, yeah.
And without further complicating it, New York City counts as one social
Yes.
service district, and the rest of the state, every county is a social service district. So you have a tough
Yeah.
job managing the program without full power to manage the program. So how difficult is it to communicate to counties and to clients about what the rules are?
I think we do our best. I think we work well with the counties in New York City in terms of having information out there on social media, on our websites, by funding nutrition outreach support workers who can also help people apply, which is very important because it often isn't easy. We try to make it easy, and you can apply online, but often people do need help. So we're really pleased to have the nutrition outreach program to support that. And I must say that while we have not been able to, we have definitely operated many new programs, restaurant meals program being one over the past several years, but at least we're not under a hiring freeze. We were under, it wasn't technically a hiring freeze for years, but it was a hiring freeze. And so the fact that we're able, even though it's difficult, right, it still is difficult to get certain people in the door that want to work. We're only 50% remote. That sometimes is a turnoff. But definitely has been a challenge. But we have a lot of really, at the state level as well as at the county and city level, people are really dedicated, and they know if we have an opportunity to implement a new program that's going to help individuals, then we're going to do it.
Right. And is it true that the vast majority of people receiving SNAP in New York are working, elderly, children, people with disabilities, and veterans?
Definitely about over 60% would be children, elderly, and disabled. And then there's another group that are also working. I think it's about 40% working, but not 100% sure.
So a lot of the debate now over work requirements is hyper-focused on this one population, able-bodied adults without, dependents. And now they're trying to change it and saying, for rich people, raising children is work, but for poor people, somehow it's magically not work. But we won't go there for a second. But nationwide, I was told that population is about 7% of the caseload. Do you know what percentage of it is here?
I don't have the percentage, but I do have the numbers with me because one of the changes in the House bill, so there are existing ABOD work requirements, able-bodied adults without dependents. New York State and many other states have been operating under waivers that we have been able to obtain from USDA. So we haven't implemented the program in New York for many years other than this past year. We had to implement it in the county of Saratoga only, a pretty small county with very low unemployment. So the House bill would, I think even without new legislation, USDA has certainly signaled that we are not going to get any more waivers unless we have unemployment above 10%. So regardless of what happens in Congress, we are going to need to re-implement these requirements. And so for the existing population, so that's households without children, that would be over 230,000 individuals in the state of New York. The House bill looks to expand the requirements to increase the age requirement. So right now it's for individuals up to 54. It would go up to 64. And then also, somewhat shockingly, would also apply these, I call them time limits, not work requirements, and I can explain that why. But also to apply these really strict work requirements to individuals who have no child under 7 years of age in the household. So if your youngest child is 7 or older, or it may even be 6 or older, then you would be subject to these new time limits. So it's extremely harsh. And all three populations together, it's over 600,000 individuals in the state of New York.
And doing so requires a boatload of paperwork from you and the counties in New York City, does it not?
It requires a boatload of paper. It requires a boatload of tracking and keeping track, which is going to make the program more difficult to implement, more difficult for recipients, most importantly, but also difficult for the counties, which would probably contribute to higher error rates, which may be all of the part of the plan, right? Shift more money because error rates go up. But the reason I call these time limits, these work requirements are considerably more harsh than TANF work requirements, and I think people need to understand
cash assistance.
that. Yes, much more strict. So the requirement is 80 hours a month in a qualifying either job or an approved activity. 80 hours a month, you miss an hour, you didn't make the requirement. There are some good cause provisions, but it's 100% on the individual to make it work. So unlike TANF, or public assistance or cash assistance, as people call it in the city, TANF, the city has an obligation to help people. You have to help people find a job or enroll a person in an activity. You have to provide transportation and childcare so that the person can participate. If those things are not in place, it is no fault of the individual and there is no negative action. The SNAP work requirements, none of that applies. There's no obligation right now from a federal standpoint. I don't know what New York will do, but from a federal standpoint, there is no obligation for any government entity, federal, state, or local, to help people find a job, enroll in an activity, or to provide required support services. So if they need childcare and they can't find it, they're out of luck. And the time limit, so you can only have 3 months in any 3 years where you're not meeting the 80-hour per month requirement. If you get to that 4th month and any month after, if you're not meeting the 80 hours, you are not eligible for SNAP. So it's extremely harsh. We are relatively confident that the Senate will not pass this with respect to the households with children, but it certainly would only be if Republicans step up and speak up against this. We are very concerned, though, that this will certainly be something that will apply to households without children. Like I said, even if there is no federal action, we expect we will probably lose our waivers.
Yes, and it's important to note that people who are working have to either electronically or in person go to an office to prove they're virtuous enough to keep getting these benefits. So sometimes people have to lose wages to prove they're working.
To document their hours. We will try very hard to get something so people can do that online and not have to go in person. But often people are, as you know, people are often working, people are often stringing multiple jobs together, and at no fault of their own, they're not always able to get 80 hours of consistent or more of consistent work on a month-to-month basis because they work in sectors where their job schedules are simply not stable.
Right, so under the proposal, just 2 things, and I'll let you go. I see the Councilman Botcher's here. The number 1, under the proposal, if you're 63 and you've been working in a steel mill for 30 years, the steel mill closes, let's just say hypothetically the tariffs didn't work, and you lose your job. If you can't find employment within 3 months, you lose your food.
Correct.
And 2, that you may remember someone remarked that the presidential candidate's wife wasn't working because she was only raising kids. And as a conservative candidate, and people went nuts, how can you say raising kids isn't real work? This proposal would say that if you have a 7-year-old at home, that's not work, and that doesn't count. And I watched the full 10 or whatever, 20 hours of the Agriculture Committee hearing, so you don't have to. And people asked about this provision, what's going to happen to kids with disabilities? What's going to happen to kids over summer if their parents are working? And the answer was humana, humana, humana. And I take it you have no resources, at least now, to help those folks. This doesn't come with a huge increase in child care funding. It
does not come with an increase in child care funding. So there are certain exemptions if someone's unable to work, or certain caretaker requirements, but not simply because you have a child. That would not qualify as an exemption. And like I said, without increased child care or other supports that people may need to cobble together to make sure they have 80 hours on a consistent basis, we are extremely concerned that many people who need SNAP, deserve SNAP, rely on SNAP, will lose access to SNAP. And so we are fighting very hard. We are writing letters. We are talking to people. We are making visits with the Republicans and Democrats, trying to educate and make sure people understand just how critical SNAP is.
And the truth is, restaurants benefit from SNAP both directly and indirectly. Benefit directly through the Restaurant Meals Program, but when people get a little government help to just survive, even if they're not in the Restaurant Meals Program, they have a little left over, goodness forbid, they can take their family out to an affordable restaurant for a special occasion. And
Absolutely.
so again, we all believe that low-income people deserve the same equity, same dignity, and same choice that everyone else deserves.
Absolutely.
Well, thank you so much. Really
Thank you,
appreciate
Joel.
your public service and everyone here from OTDA.